You know, your spine is an absolute marvel of engineering. It's strong, it's flexible, but over time, it goes through a process that we all kind of hear about and maybe even fear a little bit: disc degeneration. So today, we're going to pull back the curtain and decode the real story of your spine.
Okay, check out this number, 98%. By the time we hit age 70, that's how many of us will have evidence of disc degeneration on an X-ray or MRI. It's pretty much a universal part of getting older.
But here's the real puzzle, the question at the heart of all this. If nearly everyone's discs are breaking down, why isn't everyone walking around in pain? How can one person have an MRI that looks, terrible, but they feel totally fine, while someone else has a perfect-looking spine and is in agony? That's the key difference we're exploring, where normal aging ends and a painful problem begins.
To really get this, we have to start with the star of the show, the intervertebral disc. Just think of these little guys as the amazing high-tech shock absorbers sandwiched between every bone in your spine.
So what's their job? Well, it's basically twofold. First, they have to absorb all the pressure and weight your body creates every time you walk, run, or lift something. And second, they let you move, bend and twist without your bones grinding together. It's a truly brilliant design. The easiest way to picture how it works is to think of a jelly donut. Seriously. A healthy disc has these two main parts that work together perfectly: a tough, chewy outer wall and a soft, squishy, gel-like center. This simple setup is the whole secret to its amazing strength and flexibility. Let's get a little more specific. That jelly in the middle, its official name is the nucleus pulposus. In a young person, it's mostly water, like over 70%, and that water creates this internal pressure that acts as the perfect cushion. Then you have the donut part, holding it all in, the annulus fibrosus. This thing is made of up to 25 layers of super tough collagen, all crisscrossed like the belts in a steel-belted tire. It's incredibly strong.
But just like the rest of us, this jelly donut doesn't stay the same forever. It has a life story of its own, and it changes over the decades.
In our 20s, our discs are at their absolute peak. They're plump, they're full of water, they're doing their job perfectly. But then, as we head into our 40s, they start to slowly lose a bit of that water and the special molecules that hold on to it. Fast forward to our 60s and beyond, and the disc is a lot less like a gel-filled shock and more like a tough, fibrous pad. This isn't a disease, it's just the natural, predictable journey of a disc over a lifetime.
You can really see the difference this process makes. A young, healthy disc is tall and hydrated, leaving plenty of room for nerves nearby. But as it degenerates over time, it loses that height, it gets dehydrated and flattened, and that can start to cause some crowding and pressure on the nerves nearby. Now, you want to know what kicks this whole thing off? It's the loss of one specific molecule called aggrecan. You can think of aggrecan as these tiny little sponges inside the disc that grab and hold on to water. So as we age and lose these little sponges, we lose water. When the water goes, the internal pressure drops, and that's the trigger that starts the whole degenerative cascade.
Which brings us right back to that million-dollar question. If this is all a normal part of aging, when does it actually cross the line? When does it stop being just a sign of getting older and start becoming a painful disease?
Well, a lot of the time, pain starts when the disc structure begins to fail. As the donut wall gets weaker, it can start to bulge out. That's a protrusion. If it actually tears, that inner jelly can start to squeeze out, which we call an extrusion. It can even break off into a free-floating fragment. Now, if any of that bulging or escaped material pushes on a nerve, that's when you can get some serious pain, like sciatica.
And while we all get older, some things can definitely speed up the process. Age, of course, is the #1 factor, but genetics play a huge role. Some studies show it could be responsible for almost 80% of severe cases. And then there are lifestyle factors like a high BMI, which adds extra mechanical stress and also promotes low-grade inflammation throughout the body.
So, let's say you're having pain. How do doctors actually figure out if a degenerated disc is the culprit?
Usually the symptoms themselves give a big clue. If the issue is in your lower back, your lumbar spine, you might get that classic sciatica pain shooting down your leg. If it's in your neck or cervical spine, the pain often radiates into the shoulders and arms. It's less common in the mid-back, but when it happens, people often describe it as a tight, band-like pain around their chest.
The process of diagnosing it is really a logical investigation. It all starts with the doctor just listening to your story and doing a thorough physical exam, checking your muscle strength, your reflexes, your sensation. It's only after that detective work that they'll move on to getting pictures. And the best tool for the job, the gold standard, is an MRI.
It gives this incredibly detailed picture of all the soft tissues, the discs, the nerves, the spinal cord, and lets doctors see exactly what's going on and if anything is getting pinched.
Okay, so that brings us to the most important part, right? What can we actually do about it? Well, the path to relief is often way less scary than most people think.
Here's the really good news. For most people, pain from a disc issue is self-limited. That's a fancy way of saying it often gets better on its own with time. And because of that, the vast majority of patients are treated without ever needing surgery. So what does that non-operative treatment look like? Well, it starts with the basics. Lifestyle tweaks like weight management, physical therapy to build up strong core muscles, maybe some anti-inflammatory meds to calm things down, and sometimes a targeted injection can help cool off a really irritated nerve. Surgery is really only for cases where all of this has been tried and failed, or if there's a serious neurological issue. And looking down the road, the future is really, really cool. Scientists are working on therapies that go beyond just managing symptoms. The big goal is to actually fix the underlying problem, to find ways to regenerate the disc tissue itself and restore it to its former glory.
So there you have it. Disc degeneration is a totally normal part of our life story. For most of us, it happens silently in the background. For some, it becomes a real source of pain. But understanding what's actually happening inside your body is always the most powerful first step. The only question left is, what's the next step you're going to take for your own spinal health?